Well, the coalition government has called today a momentous one in Aboriginal affairs, with $1 billion worth of Indigenous programs officially transferred to mainstream departments. The fight over the ATSIC board and legislation to abolish it is still before the Senate. But today ATSIS, the manager of all Aboriginal programs, lost all its power and 1,300 staff were transferred to other jobs. A former Royal Commissioner into black deaths in custody, Hal Wooten, says ATSIC should never be resurrected. Instead, regional Indigenous initiatives flourishing without any control from governments should become the new model for tackling Aboriginal disadvantage. Suzanne Smith reports.
This unassuming old Queenslander, nestled amongst the rainforest in Cairns, houses one of the most successful examples of Indigenous initiative in the country. Mookai Rosie Bi-Bayan, or Auntie Rose's place, is a special halfway house for expectant mothers from Cape York and the Gulf.
Hello everybody in Australia!
They come here before they have their babies at Cairns Base Hospital and often stay afterwards to get support and education. All critical measures in the fight to improve Aboriginal infant mortality rates. Back in 1976, Auntie Rose was part of a group of Aboriginal women who knew something had to be done to help vulnerable Indigenous mothers.
When I worked at the hospital and I got my pay, I used to buy food to help the girls. A lot of them were sitting around in the park and they had nowhere to go, and I'd take them home. And I was broke all the time. I didn't know what to do after time, because when I used to go to work, a lot of them were waiting for me. They never had breakfast. A lot of them didn't want to come down here because they had nowhere to go until they heard about Mookai Rosie.
Mookai Rosie was set up or established many years ago by a very incredible lady, the founder of Mookai Rosie, Auntie Rose Richards, Mookai Rosie, to provide support and care to Cape York women that came down to Cairns or were sent down to Cairns for medical reasons. And so from, you know, that original vision of providing care to women, Mookai Rosie has evolved over many years to what it is today. And currently we provide health support services to antenatal women, postnatal women, women with chronic diseases, women who come to Cairns for oncology, and generally all women's health come to stay with us, and we provide care around whatever it is their health needs or their social and emotional needs are.
Mookai has been here for nearly 30 years. It's 29 years today. 30 years is the big year next year. Rose Richards, who was the first Aboriginal liaison officer up in the Cairns Base Hospital, and she saw cases of women coming in from the remote communities, and she saw a need that there should be a place there for the women to stay, and their children, underweight children were coming through in those days in the late 70s. And what she did was she took them home. She eventually took them home to her house, where her and her daughter then care for these women and children. And then eventually she said, no, we've got to have something better. So then what she did then was went out and talked to Mick Miller and Uncle Clary Grogan, which was her brother and nephew, and said, we've got to do something about it and get some funds together to put Mookai Rosie together.
And it got bigger and bigger every time we talked about it, until one day, every time we go into DAIA office, they don't want to talk to us. They did give us a house to rent, but our neighbours didn't want us there. They kicked us out. And then we had a second house that they didn't want us in there. They kicked us out of 3 houses. And the last place we went, they wanted to kick us out from there, so we had a fight then with them and told them if they want us out of there, they come and take us out of the house. But nobody was game to come and front us, so we stayed there. And look what we got today. it was worth the fight.
Well, Mookai, because of its strong links to the Cape over many, many years, we're now looking at 3 generations of family members coming to Mookai. Mookai has, built and continues to strengthen those linkages into the Cape, Gulf and Torres. And we work in partnership with other agencies that go into the Cape, but because we've had this ongoing relationship, and it becomes part of our work culture to retain and strengthen those relationships. Mookai has had a very strong link in the Cape, and will continue to do so in our work serving Cape York women.
Look, I think it would be wonderful to have a Mookai Rosie in all of the big centres around Australia, because this is actually a blueprint for what is possible, and it's the best practice model. I think that we should continue to aim at the very highest level for good health and well-being of our people, and because we have, if I can say it, a captive audience here, we have the ability, and we actually do put in place education and training for the women who come down. So the fact that it's a pivotal place for people, for women to come to, people keep coming back here because they learn something, because they feel comfortable here, because they get support in the right sort of way. We have largely an Aboriginal and Torres Strait Islander staff, and the non-Indigenous people that work with us are very, very in tune with the way that we operate. So that's been a very important part of the way that we have operated, and the fact that after 30 years this place is still going, and that we have now the granddaughters, the grandchildren of those first people who came here, I think actually speaks volumes.
We run our service based on a case management model, and so when a client is referred to us, or when a lady is referred to us, we accept the referral and we do our own needs analysis. So we find out what we can offer this person when she comes into our care. So the health worker will do an induction and do an orientation of our premises, the routine workplace health and safety procedures, the fire walk, and familiarise the ladies with the premises. And then we sit down with our clients and do a needs analysis, and we have a needs analysis tool that we ask questions, we prompt questions with mums just to find out exactly where they're at in different needs. And so from the needs analysis, a care plan is developed with the client or with the mum, and together we have objectives that we try to meet, or we work very strongly to meet during their stay at Mookai Rosie. The health workers also play a very big role in supporting mothers in labour when mums are going in, have come to us for confinement. So while they're here at Mookai in that confinement period, they're supporting the client in her antenatal visits, so they make sure that those antenatal visits appointments are kept. We do our own monitoring of the mum, and then we relay that information to Queensland Health. If there's any findings that are outside of the clinic times, we talk to the midwives up in Cairns Base Hospital. For women from remote and rural communities, they need a home away from home and in a supported environment, which Mookai Rosie gives so well. Mookai Rosie has led the way, and is known nationally and internationally for the work it does. in supporting maternal and child health. And each year we grow stronger in getting community involvement in running this organisation and I guess determining the future direction. So, you know, in doing so, we keep very strong links with our communities because our clientele are community people from the Cape, Gulf and Torres. So.
In the year 2011, Mookai Rosie has moved to a 24-bed facility, which is double our size, and we see that Mookai Rosie is heading for bigger things. One of the things that we're looking at too is to develop 105 Balaclava Road and turn that into another place that we can service women and children from the remote communities. Mookai Rosie has been a leading organisation in child and maternal health in Australia, and last year was a proud moment for Mookai Rosie in which they received the Excellency Award in Child and Maternal Health.